The B-cell lymphomas are types of lymphoma affecting B cells. Lymphomas are blood cancers in the lymph glands. They develop more frequently in older adults and in immunocompromised individuals. B-cell lymphomas include both Hodgkin's lymphomas and most non-Hodgkin's lymphomas. They are often divided into indolent lymphomas and aggressive lymphomas. Indolent lymphomas respond rapidly to treatment and are kept under control with long-term survival of many years, but are not cured. Aggressive lymphomas usually require intensive treatments, but have good prospects for a permanent cure. Prognosis in treatment depends on the specific type of lymphoma as well as the stage and grade. Treatment includes radiation and chemotherapy. Early-stage indolent B-cell lymphomas can often be treated with radiation alone, with long-term non-reoccurrence. Early-stage aggressive disease is treated with chemotherapy and often radiation, with a 70 to 90% cure rate. Late-stage indolent lymphomas are sometimes left untreated and monitored until they progress. Late-stage aggressive disease is treated with chemotherapy, with cure rates of over 70%. Types. There are numerous kinds of lymphomas involving B cells. The most commonly used classification system is the WHO classification, a convergence of more than one, older classification systems. Common, 5 account for nearly 3 out of 4 patients with non-Hodgkin lymphoma, diffuse large B-cell lymphoma, follicular lymphoma, marginal zone lymphoma or mucosa-associated lymphatic tissue lymphoma, small cell lymphocytic lymphoma, mantle cell lymphoma, rare. The remaining 9 are much less common: Burkitt lymphoma, primary mediastinal large B-cell lymphoma, Waldenström paragraph M macroglobulinemia, nodal marginal zone B-cell lymphoma, splenic marginal zone lymphoma, intravascular large B-cell lymphoma, primary effusion lymphoma, lymphomatoid granulomatosis, T-cell histiocyte-rich large B-cell lymphoma, primary central nervous system lymphoma, primary cutaneous diffuse large B-cell lymphoma, leg type, EBV. Positive diffuse large B-cell lymphoma of the elderly, diffuse large B-cell lymphoma associated with inflammation, intravascular large B-cell lymphoma, ALK positive large B-cell lymphoma, plasmablastic lymphoma, large B-cell lymphoma arising in HHV-8-associated multicentric Castleman disease, B-cell lymphoma, unclassifiable with features intermediate between diffuse large B-cell lymphoma and Burkitt lymphoma, B-cell lymphoma, unclassifiable with features intermediate between diffuse large B-cell lymphoma and classical Hodgkin lymphoma, other. Additionally, some researchers separate out lymphomas that appear to result from other immune system disorders, such as AIDS-related lymphoma. Classic Hodgkin's lymphoma and nodular lymphocyte-predominant Hodgkin's lymphoma are now considered forms of B-cell lymphoma. Associated chromosomal translocations. Chromosomal translocations involving the immunoglobulin-heavy locus is a classic cytogenetic abnormality for many B-cell lymphomas, including follicular lymphoma, mantle cell lymphoma and Burkitt's lymphoma. In these cases, the immunoglobulin-heavy locus forms a fusion protein with another protein that has pro-proliferative or anti-apoptotic abilities. The enhancer element of the immunoglobulin-heavy locus, which normally functions to make B cells produce massive production of antibodies, now induces massive transcription of the fusion protein, resulting in excessive pro-proliferative or anti-apoptotic effects on the B cells containing the fusion protein. In Burkitt's lymphoma and mantle cell lymphoma, the other protein in the fusion is c-MYC and cyclin D1, respectively, which gives the fusion protein pro-proliferative ability. In follicular lymphoma, the fused protein is BCL2, which gives the fusion protein anti-apoptotic abilities. See also, Richter's transformation, T-cell lymphoma, references. External links, overview and video at harvard.edu. Lymphoma Association, a Euro-specialist UK charity providing free information and support to patients, their families, friends and carers.